So let me share with you what we did today. This is a patient that's had chronic problems, has been treated by their physician with antibiotics, various other medications, and received no relief. We subsequently obtained a CT scan to see exactly what was going on within the sinuses and found that they were having chronic sinus problems. Once we identified that, we gave this patient two options really. One was the balloon sinuplasty here in our office, or outpatient surgery at a surgical center. Once a decision was made to proceed in the office, which at this point in my career I think is probably the best decision for a patient like this, the patient came in the day of the procedure. He was anesthetized or numbed. The first part of that process was putting cotton in his nose, and the cotton is soaked with two medications, one that opens it up and the other one that numbs it. After about 30 minutes of that, we then laid him on a surgical table in an operative suite, although no anesthesia was necessary because we were doing this under local. We were then able to numb his nose even more with injections, but he didn't feel the injections because we had pre-anesthetized him with this other medication. Once he was numb, we were able to look in the nose, and in evaluating the nose, his left side was really anatomically quite easy to open up. The right side not so much because he had a deviated septum. Once this was analyzed, we were then able to go into the sinuses above the eye, or the frontal sinus, and this is a sinus that gives a lot of people headaches. We were able to probe it with a small device and then put a balloon into it, much like a cardiologist might balloon and narrowing of the heart's blood vessel. We then put the balloon in and we opened it and closed it a number of times, and that's because the passageway for this sinus can be long, half an inch approximately. Once I felt like this was open, I could visualize that it was open. Went to the other side to do the same. Now the other side was a little more difficult because visualization was difficult because the septum was pushed over to that side. Next we went back to the left side. We went into another sinus cavity called the maxillary sinus. Again, different angle, different position, different anatomy, but we were able to get in and open it up easily. Usually patients feel immediate relief. Getting off the table, they're already better. He got up, he was happy, said he felt a little bit of pressure. You hear a little bit of noise, but overall I think he was pleased with the results.
Dr. Daube explained to me that this was a less invasive procedure. I'd be in and out the same day, and then he'd give me kind of the nickel version of what it entailed. It was intriguing. So, and it's everything that he billed it to be. I wasn't apprehensive. It really wasn't. Other than just a little bit of discomfort, feeling like I needed to sneeze, no pain. And I can feel immediate results right now just because I have passages that I don't think I've been able to breathe out of this freely in years. So I'm excited at this point.